Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over 5 things that someone who has never had a knee replacement might not fully understand or fully appreciate. So of course, if you're someone who's had a knee replacement surgery, or if you're someone who's thinking about having a knee replacement surgery, these different things are going to be really prevalent and probably ring true for you in some different ways. And really, they're things that you don't fully grasp or fully understand, even if you might have heard about it, until you've gone through the knee replacement process and you've lived with having a knee replacement surgery. So the first one is surgery doesn't usually eliminate all of the pain and symptoms that you have in your knee and your leg. And what I mean by this is knee replacement surgery for a lot of people, and most people who have it, have very good outcomes, and they're very pleased and happy that they had a knee replacement, and if they had to go through the process again, they would definitely get the knee replacement again. Now I know that's not everyone. There's roughly 20% or 1 in 5 people aren't satisfied with their knee replacement surgery, but for the majority of people, they are happy with their outcome. But that doesn't mean that all the symptoms and all the pain is completely eliminated. It's very common and very normal to have some lingering symptoms, some pain, especially with certain activities or if you stress the knee in different ways that you're not used to, stiffness, especially in the morning or getting up after not moving for a little while, some swelling. Things of that nature are still common and very normal to have. For most people, again, these are much less significant and much less frequent and severe compared to before surgery and really helps people get their lives back. But to say that it completely eliminates all symptoms and all pain, that's just not true for most individuals. Number 2, knee replacement surgery is not a passive process. So what I mean by this is sometimes people will think that I'm going to have the doctor fix me. I have knee pain and I have all these problems. I'm going to go get a knee replacement surgery. The surgeon's going to do the surgery. I'm going to be good to go and I'm going to feel great. And this is really just the wrong mindset to have, is knee replacement surgery is an active process. It's active in how you prepare for the surgery, both in terms of physical exercises and activity, in terms of preparing your environment, preparing psychologically and mentally. It's also, of course, in the rehab and recovery is a very active process and a very drawn out process. It can take weeks to months to even over a year to really feel 100% better. And this includes doing exercises, it includes doing things to manage your pain and manage your symptoms, icing, pain medicine, compression garments, all sorts of different things. It includes listening to your surgeon and listening to your physical therapist and following the advice and the instructions that they give you. So the people who have really good outcomes from knee replacement surgery are oftentimes the people who really take that active approach to their rehab and their recovery. Taking an active approach doesn't guarantee a good outcome, but you have to take an active approach to have a chance to have that good outcome, is how I like to phrase it. Number 3. Managing a knee replacement is a lifelong task and a lifelong process. So a lot of people think, oh, I'll have the knee replacement, I'll go through so many weeks of physical therapy, and I'll feel great, I'll feel wonderful, and I'll get back to my life. And for, in most instances, that's true and that's great, but you still have to manage your knee. What I mean by that is staying physically active and doing exercises. That means taking care of your health, maintaining a healthy body weight, eating healthy, nutritious, anti-inflammatory type foods as best you can, and just doing the appropriate things to maintain the longevity and the integrity of your knee replacement surgery. So that means doing certain activities and exercises, but also avoiding certain activities or modifying certain activities to fit someone who has a knee replacement surgery. So it's a lifelong thing that you need to actively manage and take care of to get the most longevity and benefits from your knee replacement as you possibly can. Number 4, knee replacement surgery is not just for the very old. And this is something that of course has changed, and the trend is now that there's a lot of younger people who are getting surgery. People in their 50s, people in their 40s, even younger than that. And this is something for a variety of reasons that, is the topic of another video, from partial and minimally invasive surgeries to differences between people who are super physically active and people who are very sedentary, maybe not managing their weight very effectively. But the thing is that knee replacement surgery can be a very beneficial tool for people of a variety of ages. And the knee replacement prosthetics are lasting longer and longer, and there's a lot of different things that play a part into determining if knee replacement is the right option for you. It's definitely not something that you should jump into, definitely something that you need to consider with your doctor and discuss the pros and cons and the reasons and when you should do it. But don't think just because you're younger that you can't have a knee replacement surgery yet, or if you're too old you can't have a knee replacement surgery either. There's really a wide variety of ages that receive knee replacements. And number 5 is a knee replacement can give you back your way of life. And I think this is the most important one, and I saved it for number 5 because you hear all sorts of things. Sometimes you hear horror stories about knee replacement surgeries, or you hear a lot of focus on the negative things or the risks or the things you got to be careful about. But in reality, for the majority of people, again, not everyone, but for the majority of people who have a knee replacement surgery, they see improvements in symptoms, they see improvement in pain, improvement in activity tolerance and mobility, and just general quality of life and well-being and what they're able to do. And for the majority of people, that if they had the choice to do a knee replacement surgery or do it all again, and had that choice to have surgery or not have surgery, the majority of people would have that knee replacement surgery. So again, make sure you're someone who is appropriate for surgery, but in many instances it can have tremendous benefits and tremendous outcomes that are very very great and very beneficial to the individual in terms of quality of life and activities and things that you're able to do. So thank you very much for watching, everyone. Again, this has been the Knee Replacement Therapists. Be sure to hit that subscribe button and turn on the notifications if you don't already, so you can catch all of our latest videos. Be sure to leave your comments and your questions below, and I'll be sure to get back to you. Thank you very much for watching.